I'm Kat, an independent midwife from Wales. Welcome to the Mother of All podcasts, where nothing is off the table of discussion. If it leaks, cries, swears, screams, goes up, but doesn't stay up, we're talking about it. It's time to get raw and real. Your no BS guide to pregnancy, preconception, birth, adolescence, wet dreams, wet in the bed, coming home pissed. Who knows? Whatever. We're just going to talk about it. Life in parenting doesn't come with a manual. Well, not a decent one anyway. So let's just create a podcast. Welcome to the Mother of All podcasts. I don't even know where that comes from.
That's good. That's good.
That's not even in it.
That's good.
Welcome to Mother of All podcasts. Just quickly introduce yourself.
Okay, I'm Becky. I'm a mum of 3 small children. In the normal world, I work in marketing and a past history of figure skating. But yeah,
That's what you do. And you're married.
oh yes, I'm married.
Can't forget that.
Yeah, because I have another that I look after.
Yes. Because you have 3 small children and one very big one. So I met Becky through the ice skating world. I also looked after her through her pregnancy, our first one, and I was there when her daughter come bombarding into the world to Josh Groban. I'll never forget that.
But my day ever since.
I know. Well, she is actually, yeah. Today we're here to talk about breast cancer. So when I asked Becky to come on, I never in a million years thought that she would, because you're quite a private person. And I remember telling you to write a post on Instagram about it as well. And I was shocked then. So, but my gut tells me you're doing it for awareness.
Yeah,
Yeah. It's not something, you don't like share your life with people. So,
not really.
no.
Yeah.
So this is brave, not in a brave cancer kind of way. Brave as in like you're sharing it.
Yeah.
So thank you, because I know that would have been, but you answered really quickly actually. When I messaged you, it was like,
yeah.
This is
Well,
my
yeah, I think weirdly, if you can take a positive eye,
Yeah.
I think I have a lot of imposter syndrome, and I would normally go like, oh, what 12 weeks could I use to not do this? Because I wouldn't be good, and actually it's made me go, why do I not do it? Yeah, I wouldn't I?
What have you got to lose?
Absolutely.
So, take me back to, so Becky's been diagnosed with breast cancer. She'll explain. She knows more about the big words than I do. ChatGPT has helped her along more.
That's right.
How old are your children first? So just so we can set some context here.
So my eldest daughter is 7. My middle child, daughter as well, is 3, and I've got a 1-year-old son.
Take me back to when you felt that lump, because you've been breastfeeding for like 3, well, you breastfed all of your children, but continuously for 3 years, because you had Chloe and you got very close together.
Yes, so I had Chloe in the August of 2022. Obviously, I was pregnant for the 9 months prior to that, and so your breasts change a lot during that period anyway. And then Chloe was kind of both bottle and breast, but was kind of just waking in the night and having a little bit of boob. But about 2 weeks before her first birthday, I found out I was pregnant with my son Hugo, which was a surprise. Yes. So I obviously had that pregnancy, and Hugo refused a bottle. So he was still breastfeeding as and when he fancied, really. And he was 15 months when I was diagnosed. That I suppose I can't remember it not being there.
That's wild.
Because it just felt, and I don't know what I think when you read things about breast cancer, you think, oh, that's what it'll be like. If I've noticed that, or that would be, it should be something, if you feel it and it feels new. Well, it never felt new. It just felt like dense breast tissue that you have when you are breastfeeding. So there was I didn't wake up one day and be like, oh, there's I knew them. Oh, it's quite round and hard. Like it wasn't round and hard. It was very, how to describe it? If I just draw it, I don't know. I'd say it's like a cloud.
Okay.
Like it felt like
a cauliflower.
yeah, like it wasn't like a perfect shape or anything like that. And I could move it, I could grab it, but I don't know, perhaps I was naive, but it just felt to me exactly how breast tissue feels when you're feeding. And it was always my more difficult side to feed off. It was always slightly painful when I fed from that side. And I always felt that there was never enough on that side either.
So different supplies as well.
Oh, yeah.
Okay.
I can't remember with the others if I noticed that. I think I've always found it easier to feed off them.
We always get anyway for a boot.
Yeah, absolutely. So yeah,
What was different though? Well, the day that you thought I should go get this checked. Why? What was it?
divine intervention.
I love that. I got goose pimples.
Of course.
Absolutely.
But no, I was just in the shower and I thought, it's weird that my other one's not the same.
That was it.
That was it. And I don't know why I thought.
You checked it yourself regularly before?
I wouldn't say check myself.
Yeah.
But I was just aware that that was there. No fear with it, no bother with it. You know, I read all these things about young people getting breast cancer. And at no point did that register in with me, oh my God, that could be never. I just weirdly went, it is weird. We're 15 months now. It's weird that my other one isn't the same. And then a friend of mine had a cyst. So she'd kind of gone through the go and get checked.
Right now. Yeah.
So I just messaged her one day and I was like, out of interest, what was your cyst like? Because I think I've got something actually. And I'd done my own, Dr. Google. I'd read, oh yeah, that's probably fibroids.
Nice.
Then went to the GP. She obviously did a breast exam. And she said, I'll be honest, I send everyone that comes in with a breast lump to get seen. And
How quick were you seen?
exceptionally quick. So I was obviously put forward in 8.
Yeah.
But I think I saw on Thursday, on the Friday, I had a phone call from the breast centre to say, can you come in?
Did that make alarm bells ring, or were you still in this bubble of?
I do think I worried a little bit that it was that quick, but I don't think it really set off me alarm bells. And then, when I had my mammogram, they don't say anything.
No.
So I was in and out, quick as a flash. And then they bring everybody back.
Yeah, because I've gone through the screening process, and she said you're going to get a letter, and even if it says we couldn't find anything, you still have to come back.
Oh, well, I didn't get the letter, so maybe that's the difference.
Yes,
but they just rang and said, "Oh, can you come back?" And I remember saying to the woman on the phone, "Oh, right. So what? Was there anything?" And she said, "Oh, I don't know." I said, "Oh, it's a bit secretive." And she said, "Oh no, we're not keeping secrets. It's just how it falls with appointments type thing."
And then were you in panic mode?
I wouldn't say it was, no, not really. I mean, I went in that day
On your own
results with Hugo and myself.
Oh.
I know. And they gave me a gown. And I was like, oh, what's this for? And she was like, oh, in case you go for an ultrasound
And a biopsy.
And I said, oh, I don't think I need one of those. And she was like, well, you're going to have a breast exam anyway. So, take your top off and just put it on.
You're a positive pants person though anyway. So that would be, I don't know whether you like it in gut form, but
Probably not.
Outwardly, you would always be like, oh, yeah, no, I don't need that. There's nothing wrong.
Yeah. Well, I felt so well. And the other thing, I think maybe I thought when you have something in your body that is, you're doing a bad thing, you would feel you do something, but you don't. Absolutely.
They say that all the time now.
Yeah, maybe I should do more reading.
No, not on this.
Yeah.
No more. So did they do a biopsy? Did you ring anyone?
No. I just did it. Well, the consultant did a breast exam and she said there and then, we've seen abnormal cells and you've got a lot of calcifications. I don't think they can say to you, yes, it's cancer.
No, because they're sending you away, waiting for further results. So
for a biopsy. So then I had the ultrasound, and the radiologist confirmed there is a mass. And what he did say to me though was, I know now I don't need to wait for biopsy for this. The calcifications, they are definitely DCIS.
And at this point, it was just still you and Hugo.
Well, they'd taken Hugo in the pushchair.
Oh, we're
Walking around. It was just me and a nurse and a radiologist. Yeah. In hindsight,
That's what we all do, though, as mother.
I should have taken. And my friend to this day, she was the only one that knew that I was going. She says, "Oh, I should have forced myself to come with you." But actually, I don't know if that would have been good because I would have had to manage her emotions and my own.
Yeah.
So in a way, whilst I would hate to think that people doing it on their own like I did, I kind of think for me
It was the best.
it was a better way to do it.
Yeah.
Because if I'd had someone there crying or like,
Well, you would have just been your positive brand.
yeah,
You were like, it's fine, I'm going to get through it. Which is not, I don't know, everyone reacts differently, don't they? But it is. So what happened then?
so I did the ultrasound.
They gave you your child back.
Yes, I had the biopsy done, and then I went home, and then you have to wait for the results of the biopsy, which I knew
We're going to be positive. Yeah. Yeah, you'd accepted that. So who was the first person you found?
I found my parents first, who were driving in the car. It wasn't the best.
This get worse.
Yeah. And then I called my husband.
Yeah. Did they know that you had a suspected lump at this point?
No.
So you hadn't even told them you gone to the GP?
No, I didn't tell any of them.
Was your mum annoyed?
I don't think. I mean, she does say, "Oh, and if you'd have told me there was something,
Yeah.
or it told you to go before," and I'm like, "Well, that conversation would never have happened."
No.
Because I wasn't thinking it about any way, shape, or form. And as soon as I did think, "Oh, maybe I should get that checked,"
Yeah, just get on with it.
I did go and do it. Hindsight's a wonderful thing, right? But
Yeah, it is. And hindsight's wonderful for everyone involved. Like for your mum to be like, oh, I bet, because we spoke when you were in hospital last week, and I said she probably just goes home and cries.
Yeah.
Because she's like, well, if I would have known sooner, would have we called? In a mum, because you're a mum yourself, you always think that you could have fixed it before it got that worse, but we can't fix everything as mums. So that was in July. So you had the biopsy. And when did you have the results? How soon after?
it takes 17 days. But what happened for me was I was due to go in. Is it 17 days? I think it's 17 days. But what happened for me was I got a phone call the day before I was supposed to go in to say my biopsy results weren't back. So I need to wait another week because they have to go through the NDT. And for me mentally, that was really, really, really hard. So I don't think they're really supposed to do this, but I asked my GP to put them in a CRM. I booked a private appointment at my local private hospital to see a breast consultant. And I just asked him to tell me what those results meant. So she did that for me on the Friday. And I have a wonderful GP surgery. Yeah, I'm really patient first. So they did that. Sealed it in the envelope. I didn't open it. I didn't look at it. Wow. And I just took it to the breast surgeon. And he did say that I don't have the imaging, so I'm not going to be able to give you the full picture. But that I needed it for my mental health because people will tell you that unknown waiting is way worse than actually coming to terms with what you're going to have to do and, what your next steps look like and what the future looks like.
So you just kind of wanted a diagnosis, so you could plan before actually knowing what the treatment was going to be.
Yeah,
find out more about it really, because you're a bit of a need to know person.
Yeah.
So how long did you have to wait then before you met your actual consultant?
So my consultant that I met privately is my consultant now in the NHS.
Oh yeah, you did say dreamy. You absolutely loved, How soon? We're skipping forward because I want to get onto the treatment part because that's all anybody wants to know, really. How soon after diagnosis did you have your treatment plan and what kind of cancer it was? So first and foremost, what cancer is it? What's the name of it?
So I got a triple positive breast cancer, which is it's estrogen, progesterone, and HER2 positive. Don't really ask you what all that means. And And what's the question?
That one, but also, is it just in one place?
So it's gone to definitely one lymph node. Yeah, it was biopsied, but they suspect it's in another as well. So I've recently had those clipped.
Yes.
So when I have surgery, should the chemo do its job, then they'll be able to basically. Originally, we were talking about removing all the lymph nodes in that under my armpit. That potentially we might. I think it's called a targeted axillary dissection.
Okay.
So they'll just remove a few and then test them first, see if there is still, I think it works, if there's still some cancer, or would then do the surgery and remove them all.
Okay. Why not just do it all in one go?
Well, they could do, but it's quite a big surgery, potentially worse side effect.
Yes. For something that you may not actually need.
Okay. So I think that we'll see. The surgeons will make that decision.
So from what I know, and I don't know a lot about it, triple positive, they have good prognoses, don't they? They react really well to treatment.
Yeah.
So what was your original?
Probably that's what you asked. How long was it? Yeah. Treatment. It was, I think, from getting diagnosis to starting. So I was diagnosed at the end of July, and my first chemo,
which we're going to talk about as well.
It's on the 12th of September. So I think it's about 6 weeks.
It sounds really quick, but what's going through your head when you're waiting to start treatment? Because you must just want to start it straight away, like get this fucking thing out of my body.
Yeah.
Like now. Where's your head at during those 6 weeks? You've got 3 young children. I mean, you are lucky you've got a village. Like we literally just said before we started filming, going through this on your own, absolutely bonkers.
Yeah.
But you've got a village. So where's your head at? Because you're a planner. There's there is no other Becky. You plan.
I do plan. Love a plan. It's not in a great place, to be honest. I think, even though you've had, and you can Google and do all the GPT.
And it's all positive. It's all going to be like, you have a really good chance of getting through this. Does your brain still go to the deep and dark?
Absolutely.
Yeah.
I don't know how to stop that. I don't know if you can stop that.
Is it getting worse as the treatment goes along, or is being in treatment making it feel a little bit easier, those thoughts?
I don't know. I just think it's the unknown.
Yeah.
I think everything's unknown, right? But when you don't have a diagnosis, you don't really think about it, if that makes sense.
Yeah, because you don't have to.
No. Whereas now, it's always there.
Encompassing.
Yeah. And it's kind of one of those things, like, grateful for the chance, because I said to my surgeon, I just want the chance to be able to beat it. And some people don't get that chance.
Yeah.
Do you know what I mean? So it's hard because you tussle between this place of, like, grateful that I can
try and
get through it, but there's no guarantees.
No.
And that's quite a hard thing to...
It is, because you're putting, and when we talk about your chemo and how it's affected you, you're putting yourself through such horrendous treatment, and I've been front seat, so I know how bad you've been.
Yeah.
That potentially won't work. Is there any, I know the answer, but just for people listening, is there any part of you that's like, what's the point?
Yeah.
Do you think that's because you've got kids, or is that just you as a person? And if you haven't thought about it, I'm sorry for bringing it.
I think probably the kids is a huge part in that.
Yeah.
But I think I struggle with the...
You want to win.
Yes.
That's your competitive side. That's the if you give me a job, as long as I know what I've got to do, I can do it. Because you sent me a voice note and told me, and weirdly, I was in cancer clinic with my dad at the time, and my dad was like, fucking cancer gets everyone. And the one thing that stood out to me is you were like, it just can't be stage 4. Because I need to fight it, which is basically what you just said. So you're consultant. There's not, my circle is very small. And since you've been diagnosed, I've asked, me and Nathan talk about it all the time anyway, like our health, what would we do if, and we're quite, he's quite holistic, as you know, and I'm 50-50. I definitely couldn't go rogue and just had spinach to cure myself. But my circle that I've spoken to about it, I'm like, what would you do if it was, stage 3, you've got a good prognosis of getting through it? Not one person has said they wouldn't. I honestly don't know what I would do, seeing how it's affected you physically. I don't know. And I come across as a very, very strong person. I don't know if I'd be like, you were so ill.
Yeah.
So on that, skip back to, so you've agreed, you've got your plan of treatment, you've got your village to help with everything. You told Lara, how did that go? What did you say to her?
So I picked her up from a summer activity camp thing. I'd been I have a friend who's actually a children's psychologist.
Okay.
And clinical psychologist.
Yes.
And she'd recommended do it in the car when it's just you two on your own, so it doesn't feel like a formal thing. You just chatted a big thing. So I just said, Mummy found a lump in her boobie, to which she replied, "Oh, I'm sorry about that."
Don't.
And I know. And then I did say, because they say, to say,
Don't use words that are not it. Yeah, you have to
yeah, so it's something called cancer. And she did go, "Oh, no, cancer." I thought to myself, I don't think you know what cancer is. And we've never really... Do they talk about it at school? I don't know. No, I've never thought of that. She's only 7. So I don't think so, anyway. And then I just said, so, I'm going to be having medicine that might make me poorly. But if I do get poorly, that means that the medicine is working. So I was trying to frame it in a good way. And I just said, my hair, I'm going to wear something that might keep my hair, but it might not work. So, my hair might fall out. And so I think she sat with it for a bit and then just carried on with the day.
Brilliant.
As they do.
You couldn't expect any more than that. That's genius. If she revisited that conversation, if she asked any questions since, because you have been very poorly.
Yeah, but I overheard her say to her friend the other day, well, if Mummy's poorly, it means the medicine's working. So...
kids are just lush.
So yeah, I don't think it's something she sits with, because although I have been poorly, there's not been a huge amount of change for her. Her routine's the same.
Yeah.
Her activities up school are the same.
Yeah.
So trying to keep as much level of normality.
That's really important to you. Yeah. That's why you got this team around you to make sure the kids are okay.
Yeah.
So your first day of chemo, I'm laughing because it's just so unreal. I know. So you leave the house, you go with your mum. No, Nick. All packed up. What were you thinking on the way? I know for a fact you wouldn't be thinking about what actually happened.
Yeah.
But what was going through your mind? Because this is day 1 on your treatment journey.
I think nervous.
Yeah.
But keen to just get it going time. Seen a lot. I think when you're interested in anything or you're searching anything.
You immerse yourself.
Is immersed. And I'd seen a lot of people on different protocols to me, but seemingly doing well with chemotherapy, still being able to do so. And they say you shouldn't be bedridden.
Yeah.
We will have side packs. We want to know X, Y, if any of these things were to happen. We're bedridden, we need to know about it. But, we'd expect you'll feel excessively tired. So basically, we need you to rest. But... yeah.
You were proper prepped for that, though. You were expecting to have bad days, but still plan to actually get quite strong and fit during the times that you weren't having chemo to prepare you for the next one.
Yeah.
So talk me through that first treatment.
So I had.
I'm gonna watch as she's laughing, but it's just go on.
So I had part of my treatment is an injection. So I had that.
And what's it called?
Phesgo.
Yeah.
And they wait half an hour just to check the reaction. That was fine. And then they started the infusion, which she said, "Oh, has everyone gone through this with you?" And I said, "Actually, I wasn't able to go to they do this patient education.
Yes.
Hadn't been able to go to that. So she said, oh, well, you might experience some side effects that we just need to know about. You might have a rash, you might get swelling, you might start to flush, could have anaphylaxis. And literally I just went,
Is that what she said?
yeah.
Okay.
And literally I just went, I'm like, whatever.
It's weird, isn't it? Because it's the last thing they say, because that's
No, I don't know. Well, I don't know what order she said
Okay.
it, but that she covered the basis of the things that could happen. And then literally, I was talking to the nurse to say, as I do, I think I'm getting used to this cold cap. I can tell you that. Yeah, absolutely.
You just go, your Dean voltage joke.
Yeah, joke. Just laugh it off. And then my chest just, I can't really describe what it did. And it almost like, I can only describe it as like a piece of cardboard. It caved in. And I just went, I can't breathe. I could breathe, but it was like an impending sense of doom that I knew very soon I wasn't going to be able to breathe anymore.
Yeah.
And I had a sharp pain in my back. My leg, I can't really describe the feeling on my legs, but they just got very furry. And then my breathing started to get quite laboured. And they called medical emergency. They could actually go and get a cup of tea. So come back to them, he said, someone said, oh, came to the cabin and said, you Nick, you need to come with me. And as he was walking back, 12 people in a really brisk walking in front of him. And he was like, please don't beat Becky. I was happy. Oh, they were for Becky. So, yeah, I was put on oxygen. They had to sugar adrenaline in. And then I think I had a bit of a hypo.
Okay.
Which I was just absolutely shaking. Like my teeth were chattering. I can remember because they were obviously trying to get out me. There was someone
fluids.
Yeah, there was someone here shouting because Nick said your eyes were rolling back and things like that.
Oh.
I don't remember. I feel like I was there and I remember it because I can vividly remember the woman.
And when he's vocalizing what happened, you kind of put a picture memory in.
Yeah. So I can see the lady saying, stay with me. So I was obviously I don't ever think I was out of consciousness.
No.
So I remember this. Yeah. And then the lady behind me was pouring these glue things into my mouth. But I did stabilize quite quickly. I felt it was quite quickly anyway.
Well, the stupid bloody picture you showed me, you were smiling on the fucking ambulance. I'm like, you're always joking.
Yeah, well, literally
like that.
Funnily enough, so I've had chemo again since then, different drug, and no reaction. But one of the guys had seen me in the corridor that was there that day, and he actually came up to see me, and he was like, oh, I thought I saw you in the corridor. I just wanted to come and say how great it was you had your treatment today. And now he was like, I was like, yeah, he said, oh gosh, you kept us on our toes that day. And I said, oh, sorry about that. And I joked.
Yeah.
And he did say, although what I will say is I asked you as you were coming, round and stabilizing, is there anything you're allergic to? And your response was, this. So he was like, so I felt like you had a sense of humor. So I thought you'd be fine. I was like, yeah, that sounds about right.
That's brilliant. That's classic. Can you remember saying that?
No, I couldn't.
No. Wow. So you got blue lighted from the Lindgren to the heat?
Wasn't blue light, because I was pretty stable.
Yeah.
But I had to go into main ages. Yeah.
Spent the night there.
Yeah.
Which was lovely. Mm-hmm. Awaiting to find out what was next, basically. Because at that point, it's like, if I'm allergic, if there's a note, I don't even know what the chances are, but I imagine they're below 1% of having an anaphylactic shock with this chemo. You must have thought, well, how am I going to fight this if I'm allergic to it?
Yeah.
So you obviously,
I'm not going to lie, Nick could already Google the ambulance. If you can't have, you two the sofa, you can't have this drug, what you need to have. So, and the wonderful thing is, there are lots of options.
Yeah.
And people change. I understand drugs and protocols.
Yeah.
I don't think it's like everyone does it all the time.
No, it's not blanket.
There's a problem and it's required.
Yeah.
That there is a safety net for you.
So you've had an anaphylactic shock, you've had a night away from your kids already, and this is literally day one of your treatment.
Yeah.
I don't know if you remember, but the message you sent me was, oh, well, the Phesgo would have worked.
It wasn't
About anything. It was like, the positive in this is...
Oh yeah.
That would have got into my
yes,
system.
I had one. Yeah, I had one. Yeah.
So obviously you went and had another consultation, and they put you on what is called the Gucci of chemo. Is that right?
That's what the nurse said.
Yeah. Oh, the expensive stuff.
Yes.
And why wouldn't you? You deserve it after having
Yes.
being so rare that you're like whatever. So you must have been so nervous going in for that round.
Yeah.
But I imagine everyone was. Like anyone everyone's on pins. I'm a midwife. I don't look after people, but if I know someone potentially could do something that's out of the ordinary, you're just on guard, waiting for like worst case scenario. And that went well. So the treatment on that day, how did you feel going home?
Fine.
Next
Solid.
Yeah. You were eating crisps in the car?
Yeah, absolutely. Yeah, I felt fine over the weekend. Had some bone pain from the white blood cell injection, which is
Common.
And then on the Tuesday, shit hit the fan, literally. So yeah, I'd really struggled, and I always thought it would be my bowels that would be the...
Did you?
Yeah, because of how my body generally reacts.
Oh, you did tell me that.
Yeah. So, for example, with alcohol or anything.
Yeah.
And like, that's generally how my body rejects it. So I thought that might be the shit the same day. I did think if I'm going to have anything, it's going to be that. But unfortunately, I think I was having it quite aggressively. I then wasn't eating because every time I put something into my body, it was just basically blew it out. And I was drinking. I was able to drink. So yeah, I was trying to use rehydration, salts and those sort of things.
Yeah.
But by the end of the week,
Friday, wasn't it?
It was Saturday. By the end of the week, by the time I still couldn't eat.
Tuesday, Wednesday, Thursday, Friday, Saturday. And take you back to when you first had that consultation, you were asking about chemo, and they're like, oh, we don't want you bedridden. It's not meant to be like that. And that is exactly what you were.
Yeah.
Trying not to be.
Yeah.
With 3 young kids, trying to get out and, do something with them.
Yeah.
So what made you ring? Well, I know you rung like every day.
Yeah.
They go on one, yeah, I know. Name's going to come up with flashing lights.
I'm not hurt.
They're not famous for the right reason.
No, I'm sad about it as well. Yeah, I just spoke to, and they're all amazing. They're just so good in the phone, Melinda. And I think the problem was I wasn't probably hitting some of the threshold things that they look for to bring people in for assessment.
Yeah.
But it was Saturday evening, and she said, I think we're at a point where you need to have a clinician look at you.
Yeah.
Like, why don't you ring 111, go to GP out of hours, and just see what they say. So I had a really late appointment at GP out of hours on the Saturday night, to which, turns out I was quite dehydrated.
Very.
So it ended up having to go into A&E and having obviously some bloods done. And that showed that my potassium was low. I also dehydrated, so I need your fluids. But I also all the things that come with dehydration. But I had a really high heart rate, which I do actually normally wear something that tracks my heart rate, but I hadn't been wearing it since the anaphylaxis, weirdly. So I had no real concept of how hard my body was trying to work. I just knew, oh my God, I've got no energy. I can't do anything. I can't really, I'm here, but I'm not really here. And it was just more than, I think a side effect where you can need to rouse and but still have to can carry on a little bit.
Yeah.
But that just wasn't what I had.
There was no compensating. That's what that you were just, because how much weight did you lose from that first chemo to when they weighed you in hospital, in such a short space of time? How much was it?
I think I'd lost over half a stone.
Oh my God. Absolutely ridiculous. The when I will say as well, Becky got put back in the same bed that she was in when she went in with her anaphylaxis. I was like, honestly, I said, just a big bout of PTSD to go with the shits.
Yeah,
absolutely. Just to make it even more fair. So I was there when the doctor come around, and this is the one thing that you keep saying is, I was told that I'd be able to get it. The only way I can describe it is, if it was normal diarrhea, I'd just be like, oh, it's diarrhea and I can get eating.
Yeah.
But I was told that I should be able to still get up and take my daughter to school.
Wow.
And you haven't been, I know you have this week, but you haven't been able to do that.
Yeah.
Which,
Well, I was just so poorly.
you were so poorly.
I think actually the Tuesday, Wednesday, Thursday, I was okay. Like I wasn't like I couldn't go. I could go for a shower. I could pop downstairs.
You couldn't have got in your car.
Oh no, I wouldn't have driven. I was
No.
safe to drive.
So for parents out there who potentially will experience this, I think it's managing expectations, isn't it? And it's so rare for anyone to have a reaction like you did twice, where you're taken to bed, basically, like solidly, 1 day, 2 days, whatever, and then you start to feel a little bit better, which is what you've shown this week. I think that's a biggie. It's really difficult for people to think that I'm going to be able to carry on as normal to an extent and then be flawed. And this is 2 treatments in, one that went disastrously wrong, and then this one that took you to your bed.
Yeah.
Where's your head at? Like, you're going back for round 3 tomorrow.
Well, round 2.
That's one, didn't you? Yeah.
I am a little bit apprehensive. I'm not going to lie, but they have reduced my dose slightly. Yeah. I just have to hope that makes it a bit more manageable. Also, I know I'm on a low threshold now for assessment, so if I am experiencing the same symptoms,
Well, one day, yes,
absolutely,
just one day,
I will be ringing to say I need
to be seen.
Yeah,
just to manage that before it because the minute, yes, the horror hospital stay was shit, but God knows what would have happened if you hadn't have had fluids.
Yeah,
because I said to you, I'd be interested to see what your potassium is, and then
exactly.
lo and behold, it was low.
Yeah.
If we hadn't have had that information, so thankfully, they did do all of that, and we knew. But obviously, we were all praying that it was some kind of E. coli.
Yeah. But it wasn't the chemotherapy that had done it, because then I could I can say, yes,
it's an infection.
No, it's an infection. Let's move on with our lives.
It wasn't. And they've confirmed that, haven't they? So
I acted. Yeah, there was no infection.
So reduce your dose. Are they spreading it out, or just staying on the same timeline with a lower dose?
Yes.
Does that I know you're nervous, obviously, but does that sit better with you rather than having longer periods in between to give you longer time to recover?
Yeah, I don't think I think
it's consistency.
Well, yeah, and I think obviously it's based on protocol and trials. That's success based on, I don't know, I'm totally guessing here, but
you know more than you make out.
I don't know.
You're like this 24/7.
But I would imagine they're trying to do it to achieve the best success. And yeah, I assume they're doing this. They want it like this for a reason. They wouldn't be doing.
No, they're not using you as a guinea pig. Absolutely, others have been used as guinea pigs.
And I know that it's
well,
yes, absolutely. Yeah.
So, what is your treatment plan? So, is it 6? Did you say?
I have 6 rounds.
6 rounds, and then what?
And then surgery.
Mm-hmm.
And then radiotherapy.
And I know you said they're just going to take bits in the surgery. Is that right?
So they'll take the whole breath. The whole breath, as far as I know, yeah.
Yeah.
Well, I think that's my only option because of how much the size of the mass at the start, but also I got a lot of DCIS, which is basically like a stage 0 cancer.
Okay.
So it's not invasive, but I've got a lot around the mass, and chemo doesn't do anything to it.
Because it's not cancer.
Yeah.
Yeah, okay.
Because it's not got into the breast tissue, so it's not actually doing anything. But if you had a mammogram and that was seen, you would probably have it
removed.
Yeah, because eventually it would probably
that was my next question.
I think so. I'm not a doctor. Yeah, I'm definitely not medically trained. Yeah, so my knowledge is very much what Google or ChatGPT. So you've gone, I don't know, well, so don't take anything. I started medically down it on red, on green even, but yeah, that's my nostalgia understanding of it.
And then how long is radio?
I don't know yet.
Okay, depends what they find, I suppose.
Yeah, I think they do a pathology of what they remove.
So you've had one Phesgo and you've had one full round of chemo, and you had some really good news already. That is,
yeah, perception is shrink. Well, I don't want to get my head.
I know, but you are a positive pants.
I am positive. I can feel a difference.
You said that.
Yeah,
it feels
as small said that she would agree that it feels like it's dissolving or starting to dissolve. So obviously not an expert myself at all. I only go by what it was when it started
and what you feel.
Yeah. Whereas obviously she's seen people, my oncologist's seen people all the time. So
that's really interesting, because normally you would grab onto that and be like, oh my God, yes. But wow. Well, why wouldn't it make you feel like that? But I didn't expect. I thought you'd always be, well, it's shrinking. That's fantastic. But you were like, I don't want to build my hopes up. And you're not like that as a person normally. And see, it's shit because it changes your complete personality and what you would normally do. Makes you a little bit more realistic.
Yeah.
Whereas living in Becky's world is way more fun. We were chatting before we started filming about how hard it is with kids.
Yeah.
There are loads of people out there going through it, or might have just had an early diagnosis with young kids thinking, how am I going to manage? What's your advice? What have you put in place?
Well, I think first off, everyone's different. Yeah. So I think I probably had the bad end of the spectrum. You know, I think I see plenty of things on Instagram, like people I started following who experience cancer, currently experience cancer, who are able to manage. Obviously, they probably have help as well, like through family or friends that haven't maybe had the experience of hospital stay. Yeah, extra. But I do think you need to
get a village.
Well, consider that. Yeah, I was very fortunate. My parents live close by.
Yeah,
and my daughter going to school, I have people in the street that go to the same school, so they are kind of doing pickups and drop off. I've also got friends, parents that are taking with us to our school activity.
Brilliant.
So, you know, people are wonderful. You don't realise how amazing people are until you put yourself in a situation like this
where you've been
help is on offer to you. It's
phenomenal.
Yeah, it is.
Was that hard to accept?
Originally, yes, because I'm going, it's like, no, I'll do it.
Yeah.
But actually, yeah, I think there comes a point where you realise I can't do it anymore. And so, yeah, I've been very, really fortunate. We decided to take my two youngest out of nursery because of the skin infection, especially like the time of year. I think if it was the summer, it'd probably be a bit different. But, you know, root bugs and everything else that comes with it. So I have two very wonderful, healthy, like beautiful daughters, who are coming to our house, and they entertain, feed, and just keep them alive, basically, for about 9 hours a day. So I am only lucky because I have the burden. It's not burden,
no, but it is.
But it is.
And it's okay to say that. That's what I said to you. It's okay to say, actually, I don't want to be a fucking mum. I'm trying to beat this bitch of a thing to keep me alive forever so I could be a mum for a hell of a long time. And I think we're very British when we can't say, I just want to be a mum today. I shit into an eye of a needle. I just want to be in a room on my own by myself. Doesn't mean you're doing it for them. You're doing it for yourself, but like,
it's like that whole put yourself first mentality.
We just don't do it.
It doesn't naturally trigger in my brain. It says, you have to next week. Yeah.
So you've got things in place for the next round, like a short timeline of diarrhea.
Hopefully.
Very. Have you gained your weight back that you lost? Because that's a biggie.
Close. I'm not like back up to where I was, but I'm not a million miles away.
Fab. Bodies are amazing.
And that's what this has taught me, actually. I think if I'm able to fuel my body my body can recover very quickly. And that, again, it's something I'm super grateful for. But yes, it's Thursday today where I now think about where I was last Thursday. I was still really not feeling 100% at all.
Wait, were you at your mum's? No, it should be.
I was my first day back at the house, yeah. So I was better, still wasn't really able to eat anything. No, I was trying, but I was still on very bland food, very little amounts. I was still having to have like those essentials, which just the smell now. So I'm really hoping I can just avoid them. But we'll see.
You were good on them. I wouldn't let them go anywhere near my mouth. I'd rather just starve.
Oh.
Like, even the smell of him.
Yeah,
I just...
Well, when I needed them, I was fine. Now, as soon as I turned a corner, I only have to smell it, and I think, oh God, I just can't even smell it.
That's an element of trauma, though.
Is it?
Yeah, we all play trauma down, because it's a trigger word now, isn't it? It's in fashion. Oh, I got fucking trauma. We've all got trauma. But that is proper trauma. Like smells, touch, noise, anything like... So don't underplay, which is classic for you, that you're going back for another round and the last two have been quite entertaining. And just be like, oh, let's see what's going to happen tomorrow, because that's what we do. What are the symptoms? What are the side effects have you had? Have you lost much hair?
My hair's shedding, but I've also been very careful, so that I bought a pillow case, which is supposedly a good thing. I washed my hair not often, so I think I've washed it once since I've had the chemo.
Fantastic.
And I've using a whitehead comb, which they say is good as well. It is coming out. I'm fortunate though, I have got
lots of hair, and you're using the cold cap.
I'm using the cold cap.
What quickly mention before we go on to your 3, the gloves and socks things that you bought, the purple things.
Yeah, I'm wearing hand.
Can I share a picture on the end of the podcast? Yeah, go on.
Hand and feet cooling mitts, if you will, and that there's no definitive that this.
No, that's why they don't use it in the UK. But
but I again saw someone on Instagram that was wearing them, and I was like, oh, what are they? Did a bit of research, and one of the side effects of chemotherapy is neuropathy. And wearing the cooling, much like where you wear the cooling on.
Yeah, essence.
And can hopefully prevent having neuropathy later.
Yeah.
So that's why I'm wearing them.
But also knowing the amount of side effects that you've had.
Yeah, I know. Honestly.
Let's just buy gloves and socks.
Yes.
I'm going to ask you 3 questions in a minute, but before I do, 2 things. One, what's the one biggest piece of advice you would give anyone out there right now who might think they're in your situation? Or I'll be honest, I've never checked my boobs. I have now.
Oh, good.
Not a thing that I ever did. I know, shock on your face. But yeah, so what would you advise?
I just think be vigilant. Yeah, across everything.
Every part of your body.
Yeah, not just this, but going through the process of I feel really well, but there's something that's not good inside me. Yes, I'm very fortunate. I had a lump and I have done something about it. But we're in a world now with loads of information where you can see potentially what side effects or symptoms you would have if they're, off X, Y, and Z.
Yeah.
And I know no one wants to live in health anxiety, and I feel like I am probably going to, I was. That's just my...
You are.
That's what I've got.
I would say
yes, absolutely. And I wouldn't wish that on anybody else, but I would also just think, advocate for yourself. If your gut says this,
or actually what it was,
yes, or if you question something, just go get it seen. Because actually, as they say, most people that get their breasts checked, 90% of the time, it's nothing.
It's nothing. Well, mine wasn't. So.
And, the breast nurse, when I spoke to her, when I was waiting for my results, I rang and spoke to her, and she said, honestly, we see so many people, and most of the time, it's clear. Unfortunately, knew there wasn't.
They must hate that phone call. because they're not used. This sounds ridiculous, but it's the same in midwifery. We're just not used to giving bad news. So here, saying 90% is good news. You're that one person that they had to ring. I can't. She would have gone home and drank a bottle of wine. Anyone looking up to you would in the moment, I'm sure. So before we ask you 3 questions, you've got good prognosis, good, everything's going to be okay, as much as we can hope that it is.
I hope so.
Yeah, as long as you don't have any other adverse outcomes. But there's also, like you said, there's always other trials, isn't there? But come on, I don't believe in you fucker up there, but if there is someone up there, give the girl a break, will you? Let's Margaret go snooze.
Going, third time in the
Come on.
yeah, key.
Come on.
I just like a manageable performance.
Yeah. Because
Performance.
when we first chatted, when I brought the girls over to meet the kids, you said it's 6 months. I can do 6 months. It's been 2 and it feels like a year already, and I'm a bystander. Yeah. So God, it hasn't gone quick at all.
No. No. When I'm not well,
Yeah,
it has
it's the longest day.
has gone super.
Well, I can't believe you look, because I haven't seen you since your hospital admission, and I said you look so well.
Yeah.
Fantastic, but it also shows how poorly you actually were.
Yeah.
And you were actually really upset. So I'm just, like I said, if you've got all these things go through your head, like, but what if I can't have chemo?
Yeah.
Boy, well, you would always go to the darkest place first. But when you're feeling well, you're
Not
actually
gonna
like,
yeah, absolutely.
yeah, that's the same with everything, isn't it?
I think so.
First question. What would you go back and tell your younger self? Don't say check your boobs, because that's proper cliche. And it's a fucking way out now. I want you to think about, what would you go back, if you could, and tell your younger self?
Probably to a bit cat love.
I would really?
Yeah. I would probably say that life isn't the romantic, if you do everything as per the rules, it'll all be okay.
Yeah.
Like, that doesn't exist.
Not at all.
And I think for a long time, and definitely when I was younger, I believed that, I'm a good person.
You're a good
I
girl.
find I'll always do this. Therefore, that means bad things don't happen. And sadly, the world doesn't work like that. And I think telling my younger self that, from a tough love point of view, would probably be key.
Well, it's done you no favours. And we said that, and I can't lie because I'm a jokey person as well. But when you're really poorly and you're joking, it does you no favours. And being a good girl doesn't.
No. And I'd also probably say, but you are stronger and more capable than you think you are.
You way are. You're more strong. You
really are. Yeah. And I'd probably say the voice in your head that always tells you you're not good enough. It's just a buzz.
It is.
And I probably need that advice to myself now. Yes. So when I say it to my younger self or to my 40-year-old.
Yeah, no, well, damn right. Every day.
Yeah.
Are you going to instill that in your kids now?
Yeah.
Yeah.
100%.
Do you think you would have before, or would have it been do good? Hey.
Yeah. I don't know. I'm honest.
It is. It's my next question, but it is a defining.
Yes.
A defining moment is for many reasons. That's. I like that. That's bonkers. You don't regret the person that you were before, because you're beautiful Becky. That's why you are, like, one of the kindest people in the world. But you still will be. You've just got to be a little bit more realistic.
Absolutely.
Yeah, definitely. On that word defining, what is a defining moment in your life? Don't say this either, because you can't let this define you.
No.
And that's too cheesy for my podcast.
There we go, then.
Had to scrap that word.
Fine moment. I don't know. I suppose probably when I quit skating. It is how we came to know one another.
Yeah.
But I think I spent most of my teenage years training, sacrificing as people that try to do sport at a high level.
Yeah.
I never did 4 days in school. I traveled for training. I would be up before school. I would be doing whether it be skating or another activity.
The support
To support skating. I left home at 16 and moved to Birmingham to train. That was where my coach at the time lived. And I went to sixth form college there. I didn't stay very long. We went to a competition, and on the plane home, I just said I can't do it anymore. Which was, for me,
That's not you.
no. And for me, even now, if I was in a situation where I had to say and inconvenience someone and other people, which was what I was doing, and changing everybody's life, it wasn't just me that was affected. Yeah, it affecting a lot of people. So yeah, I think that was quite a defining moment. And then tried to find out who I was without a thing that I'd done since I was 7 years old.
That's Kellen right now, which is what I sent to you earlier. It's a nightmare. When I quit skating, I felt bereft. It took me a while. I didn't give up. I should have given up a lot earlier than I did.
Yeah.
Because I started skating at a later age. But I went straight into coaching. So I didn't really feel that. But I totally felt it when I quit coaching 2 years ago. It's like, who am I? Am I just happy to be Kat the midwife? When I was old, Kat the midwife, Kat the coach, Kat the synchro coach, Kat the coach at Team GB. It's like, it's horrible. How long did it take you to find out who you were? Because you didn't coach straight away.
No.
Ages.
Like that sort of level of skate. Well, I stopped that at 18, but then I did start skating with someone else, which had potential progression. But then that wrapped up quite quickly. And then I think after that, to be honest, I'd spent so many years being so busy with it.
Yeah.
I don't know that I missed the skating.
Mm-hmm.
But, as with everything, there's a lot that comes with it.
Yeah.
And I didn't really miss.
The lifestyle and the bollocks and the politics.
And I didn't miss any of that. And it's like the same as when I eventually quit coaching. I missed the thing I was passionate about.
Yeah.
But everything else that came with it actually superseded that. And I don't miss it.
It's an easy no, isn't it, when you've come to that decision?
Yeah, absolutely.
God, can you imagine if you were coaching now with all of this going on as well? No, absolutely not. A book, a quote, a song, or a film that you think everybody should watch or listen to or read?
Okay. So funny thing. I'm one of these people who can read a book and then someone will say, what have you been reading? And I'll say, I can see the storyline. I've got no idea what it's called, and I've got no idea what the name of the book is. And I'm pretty similar with films. I can watch a film, not recognise the name of it.
It gets really embroiled in it. It's like it's made you feel something.
Yeah.
And you can't remember.
No, I'm really good. Like song lyrics.
Yeah.
Some I can remember. I list songs like that.
Yeah.
Like a storyline I can remember, but actually a book. So something that, a go-to film for us.
Yeah.
Is A Good Year.
Really?
Yeah. I love that film.
Brilliant.
And I think it's...
Why?
I think it's quite, in a way, it's just that definition of success in life.
Yep.
Yeah, I know. You have this high-level trader.
Yeah.
Who actually... Spoiler.
Yeah. Most people, I reckon most people who watch that,
sets it all aside. And I think when we're all looking at life and actually, when mortality is questioned, I think, what am I going to think? What am I going to be really happy with at the end? What am I going to remember? I don't think it's going to be that day on the stock market floor. So I think that kind of encompasses a lot.
Definitely. It's weird that you've always been drawn to that film.
Both Nick and I, yeah.
And you're both really like motivated and clear, and that's mad.
Yeah.
It is such a good film.
Yeah.
Have you watched it since your diagnosis?
No. I'm very small in what I'm able to.
Yeah, because I was like, come on, Beck.
Yeah.
Let's watch This Is Us again.
No.
For the sixth time.
No, emotions are frail.
Yeah.
So it's comedy. Victoria Beckham documentary's coming out.
I know, I'm so excited.
Holidays documentary's coming out. Not so win. So I'm trying to find things that don't come on the heart.
Yeah.
Because weirdly, and this is weird, if you believe in signs.
I do.
I know you do.
I'm a hippie.
So pre-cancer diagnosis,
Yeah.
Nick and I watched again, I can't tell you what the name of it is. It's on Netflix.
Yeah, okay.
I think it might be called This Is In This Time or In Time or something.
Okay.
What happens? She has cancer. Do you know what she used to be?
Oh my.
Figure skater.
Shut up.
Yes.
So you watched it pre-diagnosis?
Yes. And all I kept thinking was, I wish I'd watched that fucking film. Like, that was all I kept thinking about. Because it didn't spark me to do anything.
That was my question.
And now in my head, I just can't stop thinking about the fact that we watched a film that is so...
Your life now.
Yeah.
Your storyline.
Well, I hope it's not my storyline.
Oh,
But
sorry.
yeah.
It's not going to be.
Yeah. But that for me is like a really watch it. It's actually a very it's a nice film.
Yeah.
I can't you'd recognise the actor and actresses.
Well, I'm so going to Google the storyline and then it'll tell me the name. But I can categorically tell you I will remember the title. 20 years ago.
My brain just doesn't do it.
One last question before you go and get ready for tomorrow. What is the one thing that you're going to change after you've got through all of this? I know what I want you to change, but I'm asking you, what's the one thing?
I am going to have to be slightly selfish.
You're the least selfish person I've ever met in my life.
Yeah.
I have had conversations about, I wonder why you're here.
Yeah.
Like, when have you ever had a Becky day?
No, they don't exist.
They'd been in bed last week while you're shitting yourself.
Yeah, they were
Literally.
that was yeah. And again, things like where I've sometimes thought to, I really wish I had a day just to watch a box set. And now this is where I ended up. I'm like,
Yeah,
I did it for the twice out.
Yeah, for the...
Do I jinx myself? It's by actually having that thought. Like all these things coming into your head. It's such a weird place, to be.
Yeah.
But this is where we are. So what am I going to change? I'm new to the market myself. I wouldn't have said I didn't look after myself.
I've always looked after yourself. You've just never
Put myself first.
ever.
No. And we do. As a unit, we, my husband has a really stressful job and comes with its challenges. And I think we always had to protect that.
Yeah, because he's where you live. Like, that's all based around him.
Yeah, need to protect his mental health.
Yeah.
His physical health, because we knew the effects that stress can have on the body, poor mental health.
Huge.
So it's always, and I think he would agree, that we were probably more inclined to ensure that he was well.
Yeah.
And because I am someone that keep going, I will break.
Yeah.
We have, yes. But normally it's more of a have a bit of moan.
Yeah. Go to the toilet, have a little cry.
Yeah.
A little sniffle.
Whereas, this is a physical problem.
I'm going to say it was a divine intervention. You're going to be absolutely fine, but it was needed so you can sort your shit out.
I mean, I would have liked saying it could be for I could have taken
longer
for a break. Something else would be really, really nice. I'm just going to throw it out there.
Yeah, no, I agree.
Yeah.
Just a little warning.
Yeah, at least a warning.
A little warning, not a massive of one. When you come back on and let us all know how you're getting on through the treatment, Sean, I hope it's not as quick as next week, because I hope tomorrow goes really well and we've got nothing to talk about.
Amazing. Can I see you next February?
That would be brilliant.
And for the surgery, I'd be like, here we are, this is what's left, and this is where we are, and that would be nice.
That's what I would like. But obviously, if we have any updates, I'll let everyone know.
Okay.
Thank you, my lovely. Good luck for tomorrow.